This video will demonstrate our new patient outreach procedure that our providers have agreed will ensure patients are provided the opportunity to receive appropriate care and communication. There are 3 examples I will use to show you this process. We have created dot phrases and letters to save as speed buttons or favorites to make this as easy as possible. Note that prior to any patient outreach, it is important to review the patient's chart to have the appropriate information and considerations related to the outreach. This will prevent duplicate or unnecessary outreach efforts. Our first example is a patient that is due or overdue for 1 or more health maintenance topics. You will first open a patient outreach encounter. You can do this from your toolbar or from the Epic button. You may have it pinned as a favorite, or it will be under Patient Care, Patient Outreach. Once you have your encounter open, our first contact with a patient is always via telephone. So we will track our outreach. We will click telephone. Next, we will fill out what we contacted them regarding. So for this example, we're going to say wellness visit, colorectal screening, and a PAP. We then fill out our reason for call. You will select care gaps. You may save this as a button or a favorite to make documentation easier. You will next move to patient outreach outcomes. Here you will indicate if you spoke with the patient or if you left a message for them to call back. For this example, we're going to leave a message. We will then complete our documentation. You will either use the dot phrase, .pca, outreach, telephone, or you can create a speed button for this. Then complete that if you spoke to the patient or if you left a message for them to call back. We will now set a callback so that we know to follow up on this in 2 weeks. We click our callback section. Our reason for call or reason for callback defaults to care gaps. Due by clinic policy is that we will be following up in 2 weeks. You can do W+2, or you can click and select your date from here. For today's demonstration purposes, we're just using today's date. You no need to fill in a phone number, and enter message is also optional if you have any specific reminders that you need for this patient for yourself. You then complete the enter recipients. Here is where you put the nurse pool that you would like this message to be sent to. You can create a list to make this easier and default to your own nurse pool if you would like. You then click sign visit, and you have completed your patient outcome for that day. In 2 weeks, you will return, when you return to the office, you will have a new bucket in your in-basket that says callback. In there will be your patient that you need to reach out to again since the last callback. You will ensure that you've reviewed the chart to see if they have called back or if they have scheduled. If you receive a call from a patient, in the meantime, you will want to make sure that you document on these encounters so staff knows not to reach out to them again. If they have not called back or scheduled, you'll double click into that encounter and create an addendum. Our second outreach to the patient is done via mail. You'll change your track outreach to mail. You don't need to complete your reason for call as it's already defaulted from last time, so you'll move straight to your documentation. In here, you're going to use .pca, outreach letter, or my chart. Again, you can have this saved as a speed button. And now you need to send your communication. You will go to the communication section to send a letter. In here, we will use the letter PCA HM Outreach. You can save templates as your favorites. You will then select that you're sending the letter to the patient. Here it will default to mail or my chart. If you're going to send this via my chart, please ensure that the patient is checking their my chart on a regular basis. This letter will indicate that this is the final contact with the patient for 1 year regarding their need for 1 or more health maintenance recommendations. Complete the areas of the letter. So we're contacting for physical exam appointment. In here, we'll just put, again, 2 weeks if we do not hear from them by, we'll make no longer any further attempts to reach them. So that will do 12/15/23. And then complete the provider you're sending this on behalf of. No need to set a further callback, as this is the final action with the patient and we will know their attempts for a year. So you can click Sign Addendum, print your letter, and then you can done this out of your workload. Our second example is going to be a patient that has had no office visits or communication with PCA for 5 or more years. The first outreach is by telephone. Again, if they do not answer, leave a message for them to call back. So we'll do telephone. We contact them about PCP update. Reason for call will be update. And then we'll complete our documentation. We'll do .PCA outreach telephone, or your speed button if you have it, and the outcome of that call. So we're going to say that we left the patient a message. We will then complete our callback to follow up with this patient in 2 weeks. And then completing your recipients. Okay, we're going to change this to today just for demonstration purposes. Okay, you will then sign the visit. It has now been 2 weeks, and we come into work, and there are patients in our callback bucket to follow up on. We will complete a chart review and check if there has been an appointment scheduled. If not, we will go into that encounter and create an addendum. Our second outreach to this patient is a letter. So we change our track outreach to mail, and then we can move to our documentation. You will use the dot phrase .PCA, no contact, no visit. That says that this is the second attempt to reach you regarding the intent to continue with the primary care provider, and will request contact back from the patient by 12/29 for this purpose, this demonstration. Okay, we then have to complete our letter to our patient. So we go to communication. We are going to use the PCA no contact, no visit letter. Again, you may save this as a favorite for easy access. Select that we are sending it to the patient. Make sure you verify that it's mail or my chart, and select the appropriate action. Okay, in here we will say that we last contacted the patient. For this demonstration, it would have been 12/15/23. And then we say, please contact us by 12/29/23. And this letter indicates that this is the final attempt to contact them. If we do not hear back from them, we may be removing them from the PCP's panel. Okay, we will then print our letter and go back and complete our callback to follow up in 2 weeks. So go back to your patient outreach encounter, go to callback, do week +2. Again, for demonstration, we're doing today's date, and add in your recipient. You'll complete sign addendum. Okay, it has now been an additional 2 weeks, and the patient fell back in our workload. We will review the chart again to see if the patient has contacted us or scheduled an appointment. If they have not, we will now be sending it to the PCP to determine if they would like to keep this patient on their panel. We will use a documentation .PCA remove PCP. We will complete that we contacted this patient on 12/1/23 and 12/15/23. You will then route this to the primary care physician. However, for demonstration purposes, we will not be doing this today. Once the PCP responds back to you, if they say that they would like to keep this patient on their panel, no further action is needed, and we would just sign the addendum as we are done. If the PCP wishes to be removed, we will then do documentation that says .PCA PCP has changed. We will send our final contact letter to the patient and update the chart with unknown PCP. So first we'll go to communications. We're going to use the letter PCA PCP removal. We're going to select that we're sending this to the patient, again ensuring that we're either mailing or sending via MyChart. The letter is completely filled out. There's nothing you need to address in here. You can hit print now. Okay, our final step in here is to update the chart with removing the PCP or changing the PCP to unknown. So in here we will click over in the PCP section. We can end our PCP. And then in add PCP, we can do unknown. Okay, and then you may sign the addendum and done the callback out of your workload. Our final example is going to be a quick telephone encounter. So you'll create a telephone encounter. We can use this as reminders for results, follow-up imaging, or blood pressure reminders. So in your telephone call, you will notice that there is a new section under Take Action. It's the callback section. You would click on that and complete the callback just as you do for the examples we have shown before. In summary, all first patient outreach should be done by telephone, even if this is not the preferred method of communication. All second patient outreach should be a letter sent through mail or MyChart, if active, and checking their MyChart. In total, there are 5 dot phrases and 3 letters you were shown today. Once these are saved as speed buttons or favors, this process will be consistent and efficient. There are the patient outreach procedure and patient outreach tip sheets available on OneNote and on the L drive under nursing policy and procedure for reference.